The Regional Center is the university's link to the community. Healthy Start Grant is important because of the prenatal care that it involves to the women of Robeson County, especially the women of Robeson County who would be what we consider on the lower socioeconomic background. Ladies who would not typically be given the chance to receive prenatal care up front. The Healthy Start program helps to ensure that.
This grant has been here at the university for a little more than 12 years. Our funding source comes from the federal government. We're funded through the Department of Health and Human Services through the Health Resources Services Administration. Healthy Start as a whole has been around for about 22 years. Healthy Start was the governmental initiative to address the high infant mortality rate in Robeson County and all rural and urban counties where the infant mortality rate was a disgrace to our nation. So basically what we're dealing with here in our county is a high population of minorities. Our Robeson County is a large rural community where there is a triracial breakdown of 38% American Indian, 32% Caucasian, and roughly 23% African American, with a growing Hispanic population.
In the beginning of my pregnancy with my 4-month-old, the transportation services that they offered, they would come and take me to my prenatal appointments to keep me regularly on my prenatal appointments. And towards the end of my pregnancy, I was notified that funding had been cut out because they just didn't have the money anymore to be able to transport us on the program back and forth unless it was emergency situations. And that entailed what caused me not to be able to continue getting prenatal appointments at the very end of the pregnancy.
This program and programs like this that will help break the cycle of poverty, because it's a very vicious cycle. You just, without the proper education, you'll never know how to go about even starting to try and break out of the cycle. I mean, because I'm sorry. It's just very overwhelming. It is very overwhelming, and you're constantly living in the now. You can't never plan for the future to even get ahead a little bit, because you're always in a crisis, always trying to. You got one bill that, oh my God, what am I going to do? Oh my God, oh my God, oh my God, how am I going to pay this? They're going to cut the lights off, or where am I going to live next week, or where are we going to go? And that was just when it was just me. Now that I have a child, it's like double the pressure, and nobody knows that these resources are out there. I mean, and without programs like this, then there's no hope. There's not.
I am currently at our house in Pembroke, which is a substance abuse program for single mothers and new moms. I have been there 90 days. I've been clean and sober for 90 days. That is where I was introduced to the Healthy Start program, along with Bridges Out of Poverty, where I learned different resources to help me stay out of poverty. Also learned healthy ways of living for me and my children. Learned how to budget money, do little odd jobs to make ends meet. Just different resources so that I don't step back to where I used to be.
Well, Healthy Start has let me know that the only person that can give up on me is me. It's taught me that my opinions are important in the community. It's taught me about budgeting, about poverty, about a living wage, how to express my emotions and feelings through pictures called mental models. And it also introduces us to other programs and resources through the Infant Mortality Task Force.
Helping people who can't help themselves, especially the elderly. Just doing great things for my community, being a nurse. That's where I see myself in 5 years.
Well, I hope to be independent and working in substance abuse, helping other women like myself, because I've learned that I have a story to tell and that my story can help someone else in the future.
But more importantly, they wouldn't have that support structure that Healthy Start has been able to provide. They wouldn't have that outreach effort of the Healthy Start staff staying in contact, of having someone to come and talk to say, you know, I just don't know how to continue. Where is my next step? With our Healthy Start staff, these mothers are able to come and do that. They're able to come and sit down and talk to a case manager, talk to the Healthy Start director, talk about their future plans. What can I do? We're able to give them hope. And hope is very important.